My name is Pat McGreevy, and I have the distinct honor and pleasure today of introducing to you Dr. Vince Carbone. One of the things that often people do when they introduce others is to draw upon a list of accomplishments or contributions, and I decided, and rather than do that, I'd just tell you a short story and let Dr. Carbone get on the business of providing you with a great tutorial, which is what you came for. A number of years ago, he and I were working in a large residential facility, and one afternoon we got a call to come over to one of the homes, a facility for individuals with developmental disabilities. And like I say, we got a call to come over to the home, and Dr. Carbone came over, and one of the young men, his name was David, 37 years old, a non-vocal individual with no system of expressive communication. And he was exhibiting some rather severe aggressive behavior along with some pretty substantial property destruction. And Vince came in the room, and the first thing he asked the people, he said, "What does David like? What are some things he really likes to do or likes to have?" And they said he loves coffee. He'd drink coffee all day if you let him. And so Vince said, "Well, do you have any coffee?" And the lady said, "Of course we do. We wouldn't live here without it." So they went and got a cup of coffee. Vince sat down with David, having never met him before. And of course, Vince had the coffee. And of course, David came to him because he had the coffee. And in 7 minutes, with an individual he had never met before or interacted with at all, he taught him a 2-step sign for pour coffee. And the individual who wrote a report on him that indicated that because of his presumed cognitive deficits, he would not benefit from any formal system of communication, was standing in the room watching this occur. And it was quite an event. That is just one of the many experiences I have had with Vince and have enjoyed them all along the way. I give you my good friend and colleague, Dr. Vince Carbone.
Thank you, Patrick. Thank you very much. An honor to be introduced by you. First of all, does anybody have a copy of the Boston vicinity telephone book that I might stand on here so that you might be able to also see me as well as hear? I think the camera people would like that. But in any case, you may have been at some sessions this morning where they were talking about their favorite, Mark Sundberg and Jack Michael and others, talking about their favorite Skinner quote. Well, I have a favorite Skinner picture, so let me put that up for you. Okay, that's obviously a picture of B.F. Skinner, but in his arms is my 3-week-old son. This was taken in 1979 at ABBA in Dearborn, Michigan. How many people were at that meeting in Yeah, it's kind of, the numbers are dwindling, aren't they? Yeah, in Dearborn, Michigan, and there is Skinner with my son, and while it's certainly relevant to this, there's some more relevance to this than you may think in just this picture. However, I will tell you that people who look at this picture who don't know who Skinner is, and I show it to anybody who'll look at it, as a matter of fact, they always mention to me, and they always say, "Who's the kind man holding your son?" And people talked this morning about Skinner's humanity. Well, you can see his humanity pretty clearly in this picture. And on the anniversary of his 100th birthday, his humanity is what comes through. How this is relevant to my talk today, other than the fact I'm talking about Skinner's analysis of verbal behavior, you'll also notice the look on my son's face, his open mouth. He's obviously screaming. I kind of documented that as his first man for food, right there. He was in the process of eating at that particular time. Skinner came out of an elevator, and I quickly went over and said, "Dr. Skinner, would you mind?" and took him away from his food. And there he was manding. Like Mark Sundberg has talked about, those mands developed very early on. And that was an example, I think, of pretty much an operant response. Well, I'd like to spend some time with you today going through the clinical applications of verbal behavior research. And if we can go back to the slide, I have to let the fellows know. Clinical applications of verbal behavior research with children with autism. It's a format, this presentation, in a way that and a forum that I don't usually operate within, so I've kind of had to constrain the presentation. So basically, why don't you do this for a little while before we get to the videotapes, which is really what you're here to see anyway. Kind of read along with me, if you will, as I kind of go through some of this. And it's very nice to see such a large audience. It's a tribute to, I think, the work of Jack Michael and Mark Sundberg to a large degree, why there are this many people interested in it, in Skinner's analysis of verbal behavior. Also, it's amazing what the promise of CEUs will do to the size of an audience, despite the speaker. It's kind of, it says something about that as well. Well, let me go through with you an outline on this, and then I'll get right into some videotape applications of Skinner's analysis of verbal behavior. Within the time I have available today, I'd like to present to you the evidence that supports the clinical application of 2 lines of verbal behavior research, and then demonstrate the clinical applications derived from the research through video illustrations. I was going to do 3 lines of research, and as I pulled it together, it was fairly obvious that wasn't going to happen, and Mark was kind enough to warn me about that, and I'm glad he did, because I'm down to 2 lines, and if I don't go through this in a systematic way, you'll probably only hear 1 line of research, but we'll try to do both of those. The lines of research I've chosen to discuss include, number 1, teaching the man for fairly obvious reasons, and the other, the role of automatic reinforcement in the development of verbal behavior, which has been an area of interest of mine since reading the '82 article by Michael and Vaughn on the topic. Now, I've chosen these 2 verbal behavior research areas because there are sufficient empirical findings to support their inclusion in treatment programs for a substantial number of children with autism. I think these 2 particular lines of research are particularly useful. While there are others as well, these 2 are particularly useful, have broad application for children with autism, and therefore I've chosen to speak about those today. First of all, treatments based upon behavior analytic principles have clearly been demonstrated to be more effective than other forms, and Green in 1996 cited that. However, Sundberg and Michael in 2000 point out that many behavioral programs have not been influenced by Skinner's 1957 analysis, and state that failure to make use of the technical concepts and principles that appear in Skinner's 57 verbal behavior seems inconsistent with the stated behavioral focus of many programs, and many of you in this audience may have similar sort of feelings about that. However, notwithstanding this issue, there appears to be a growing interest in the application of Skinner's analysis to the language problems of children. The numbers here attest to that. Workshops on the topic draw many participants. Parents and practitioners have developed well-subscribed internet listservs devoted to discussions of teaching verbal behavior. There's actually a list called the Verbal Behavior List, the DTT, NET list, and so on. And there appear to be an increasing number of practitioners who are relying on the approach. Well, maybe one of the most important things I can do today is talk about what characterizes the approach. And some of this information has been derived from personal communications with Jack Michael and Mark Sundberg, and certainly in their 2001 article in Behavior Modification really laid out what I think the verbal behavior approach is. But let me go through some of the characteristics of that approach, since there's often questions about what's the difference between a program that includes Skinner's analysis of verbal behavior for children with autism and an ABA program that does not include it. It's not a matter of VB versus ABA. There's something special about an ABA program that does include Skinner's analysis of verbal behavior. So what characterizes that? First of all, reliance on the same basic behavioral principles and independent variables that account for nonverbal behavior, evocative and function-altering stimuli, such as motivative operations, reinforcement, stimulus control, etc. What additionally characterizes it is reliance on B.F. Skinner's 57 definition of verbal behavior as behavior that is reinforced through the mediation of another person's behavior, and therefore differentiates it from nonverbal responding, an important differentiating characteristics of programs that include this analysis. Any response form that is altered in strength through consequences provided by another person constitutes verbal behavior: pointing, speaking, picture exchange, manual sign, writing, etc. Thirdly, characteristic that differentiates programs that use Skinner's analysis from those that don't, is classification of language that identifies the verbal operant as the unit of analysis, as opposed to the word or sentence, and therefore makes less use of the descriptive terms of ordinary language, such as labels, requests, nouns, verbs, and prepositions, as indicated by Sundberg and Michael. And Mark was quick to point out to me it's not limited use or no use of those terms, but the notion of differentiating between the form of a response as a noun, so to speak, as opposed to the function is the important issue. And that's why the use of those terms may be less useful when talking about it functionally the response, compared to the form of the response. Fourth differentiating characteristic is recognition of the differences in the controlling variables that differentiate one verbal operant from the other. For example, in terms of the elementary verbal operants, the echoic, man, tact, interverbal, etc., and therefore establishes their functional independence. The recognition that these responses are functionally independent, and there's certainly a good line of research that suggests that, and there were many papers presented here at ABA this year that corroborated those previous findings regarding functional independence. This recognition suggests the use of stimulus-controlled transfer procedures that are necessary to teach the multiple meanings of the same response units. And for a complete breakdown of those response units, see Sundberg and Partington, a user-friendly sort of breakdown, as a practical guide to the elementary verbal operants. But the recognition that meaning is not in the word, but is in fact in the variables that control the response, and the basic response unit being the operant, certainly changes what you do in your treatment of children with autism when you're focusing on language training. Fifth, language assessment that measures response units across verbal operants as opposed to the traditional linguistic unit of words and meanings, as pointed out by Sundberg and Michael as well. And finally, and I left out the citation for this, Michael, 1985, and maybe to a lesser degree, as Mark has pointed out, that this issue of the reliance on topography and selection-based verbal behavior literature to determine alternative methods for communication for non-vocal learners may be an extension of what we know about Skinner's analysis. And to some degree, when we use Skinner's analysis as the gold standard, if you will, for making determinations about alternative methods of communication for non-vocal learners, that line of research and Jack Michael's conceptual analysis of that guides us in ways that are sometimes different than people who don't use that particular analysis. The point is, I think, that many of us who work with children with autism and use applied behavior, we're all using applied behavior analysis. However, adding Skinner's analysis of verbal behavior is probably characterized by those sorts of, those lists, and maybe some others that other people can think about regarding this particular, the training of language. Well, let me now look at the first line of research and clinical applications I've chosen to discuss. First of all, Skinner in 57, and that being the man, defined the man as a verbal operant in which the response is reinforced by a characteristic consequence and is therefore under the functional control of relevant conditions of deprivation or aversive stimulation. So we'll start with that definition. The diagram below shows the controlling variables for the man, and I won't go through that. My guess is many people in the audience are quite familiar with that. But basically, the four-term contingency, the reinforcement being specific to the MO, the response form being controlled by the motivative operation, and so on. For example, when I'm thirsty or deprived of water, only the delivery of water will strengthen the response that produces it. Consequently, any response that produces water through the mediation of another person under these conditions will receive direct and specific reinforcement and is therefore defined as a man. Since the man is the only verbal operant that directly benefits the speaker, it may be the most easily acquired initially and with the greatest functional value to the language disordered child. There are many, many other reasons as well, as I'll try to point out a few of those. And Mark, this morning in his talk, just added to some of those reasons. Man training during initial language teaching of children with autism is particularly important, yet it does not always occur in remedial programs. Instead, receptive language training, echoic training, and labeling drills many times are the focus of many programs. And when people ignore Skinner's analysis of verbal behavior and the characteristics that I described previously, then you might see that kind of difference in programming. Notwithstanding these differences, it's clear that man training can immediately begin to address the specific behavioral deficits of children with autism as diagnosed by the DSM-4. Definition we all are somewhat familiar with, but as a way of just talking about the constellation of behaviors that are typically associated with the diagnostic criteria for autism, let me give you what those are in my abbreviated and paraphrased sort of way. By definition, children with autism engage in aberrant behaviors which interfere with their learning, first of all. They fail to develop functional communication, and they fail to develop appropriate social responses. Well, man training immediately benefits persons with developmental disabilities and autism by specifically targeting these core deficits. In fact, man training has been shown to reduce problem behavior, increase spontaneous language, and increase social initiations. You can see how teaching one verbal operant initially, although there may be other operants that you're teaching at the same time, but certainly placing emphasis upon this operant early on begins to get at the core characteristics and the constellation of behaviors that are typically associated with children with autism. Certainly recommends highly the initiation of man training in early programs, especially with children with limited verbal repertoires. Well, let's now talk about how to teach the man. Since this is a tutorial, let me see if I can do a little tutoring on it, and we'll get to some video examples of that. Given the benefits of man training and remedial language programs for children with autism, let's look at teaching it. Man training with children with autism requires the instructor, first of all, to have a well-developed repertoire of teaching skills. And Mark sometimes refers to this as having behavior modification skills, which is certainly not all you need, but being able to prompt and fade and shape and differentially reinforce is a very important repertoire in teaching the man. In addition, however, the effective teacher must have a conceptual and practical repertoire related to capturing and contriving motivation. And I think that is the issue. The issue is both practical, in terms of knowing how to actually do it, and conceptual, how to do it when things don't go quite right or don't kind of turn out the way you expect, how you can then rely on a conceptual analysis of what's going on to make a determination as to what you do next. Those repertoires need to be in the effective teacher of the man. Since the form of the man is evoked by motivational variables, an understanding of Michael's analysis and colleagues of establishing operations, EOs, renamed recently to motivative or motivational operations, is critically important to effectively teaching the man. Let's go through that definition a little bit, since an understanding of it, a conceptual and practical repertoire related to it, is important. Michael's 93 two-part definition of the MO includes an environmental event, operation, or stimulus condition that affects an organism by momentarily altering A, the reinforcing effectiveness of other events, reinforce or establishing or abolishing effect, and secondly, alters the frequency of occurrence of the organism's repertoire relevant to those events' consequences. Now that's good to know right there, isn't it? I was wondering there for a minute if that was the case. I guess I am charged. Okay. And that relates to the evocative or abative effect. And some of the recent writings by Michael and his colleagues have made clear, although it's always been fairly clear, the issue of abolishing and abative, but using the term abative and abolishing, although Jack used that many years ago as well as in his writings, the addition of those terms really helps us to kind of better understand the functionality of motivative operations. Well, in the case of unconditioned MOs, it may be relatively easy to teach an appropriate man for a food item to an early learner by merely waiting for the value of food items to become effective as reinforcers just before meals. We could all imagine just before a meal, and children are sitting down and food is possibly displayed, how they might be grabbing at the food and reaching for it. The motivation is already established. It might be fairly easy at this point, and it might be a good place to start in man training, where you could easily now evoke the form of, a different form of the man, so to speak, other than possibly tantruming or pointing or whatever, some other form of the man repertoire, and it might be fairly easy to evoke it under those conditions. However, if that's all we did, we would have difficulty in teaching many responses to children with autism. Why is that? A great deal of language is acquired and maintained by condition reinforcement, and therefore a teaching repertoire related to the first part of the definition, which is reinforcer establishing or abolishing of condition reinforcement, is necessary to teach a broad, varied, and functional man repertoire to children with autism. So knowing how to condition, as you'll see in this in the next slide, knowing how to condition objects, actions, and events as reinforcers is absolutely critical to teaching children with autism. That's where the conceptual and practical repertoire come into place. So somebody first has to do that, establish the value of items as reinforcers, and know how to manipulate conditions potentially of deprivation, satiation, and aversion, and then recognize when the MO is at just the appropriate value, and then prompt or evoke the response and subsequently fade the prompts to control by the MO and the audience. That repertoire is absolutely critical in teaching children with autism. Very different than the unconditioned MO type of mans that you might get. Failure to contrive motivation properly, however, may result in verbal responses that have man-like qualities, but may actually be responses under the control of the availability of a generalized condition reinforcer and not specific to the MO that is usually associated with a specific response. For example, the learner asks for candy due to the reinforcing value of the teacher's attention, not because the candy is now effective. You will see that sometimes in teaching advanced sort of manding, where you get the child to say, "What's that?" And after the child says, "What's that?" then somebody says, "Very nice asking, what's that?" Here's a raisin. Well, when I ask, "What's that?" I'm not expecting somebody to give me a raisin, or the reinforcer that controls that response isn't, "Well, here's a raisin." What controls that is a very different sort of relationship that we'll talk about when we talk about advanced manning. So while some responses may have man-like qualities, they may in fact be under discriminative control and not motivational control, and therefore might not occur in other places at other times when that repertoire would be particularly valuable. Well, let's look now, after a little conceptual analysis of it, let's look at the practical steps to teaching mans once the MO has been established, including stimulus control transfer procedures, as talked about earlier. The quick transfer procedure, excuse me, for teaching the man, as recommended by Sundberg and Partington in maybe it's 97, in any case, includes these steps. For a sign man, for example, the prompt sequence, the stimulus control transfer procedures, might include a physical prompt, a gestural prompt, an echoic prompt, the item being present, having some discriminative control over the response, and then, of course, to fade all those prompts to the MO and the audience. If you're working with a vocal learner, a child who has a pretty good echoic repertoire, and you can bring it under pretty good stimulus control, you might use a prompt sequence that may include the echoic prompt, the item, and fade also. You notice the intraverbal prompt that has sometimes been recommended, "What do you want?" Is not included in this. I have found, and I think Mark has suggested recently as well, I have found that asking "what do you want" sometimes leads to a fairly restrictive manned repertoire. I had a child in my office not too long ago who her parents indicated she could mand for almost anything, and that was true as long as the item was present. In addition, there was one other controlling variable. You had to say, "What do you want?" If you didn't say, "What do you want?" she would beat you up pretty much to get the reinforcer. She would become very aggressive. As soon as you said, "What do you want?" you would get a vocal response. So clearly that may be an issue to consider in practical application. Okay, let's now take a look at, let me scroll down here a little bit, and let's take a look now at teaching advanced manding. Manning for actions and missing items. Advanced manning allows a learner to more effectively control the social environment. Teaching these skills to children with autism usually requires a sophisticated teacher repertoire related to the manipulation of the relevant MOs. In some cases, the presence of one stimulus may increase the value of a second stimulus. For example, when it is important to retrieve an item from a locked closet, S1, and the key is not to be found, S2, The key is now established as a reinforcer and will evoke behavior that in the past has produced misplaced items, searching, asking somebody where it is, and other forms of the response. Michael in 1993 named this type of independent variable a conditioned EO at the particular time. I've changed over to MO, but a conditioned transitive establishing operation, now MO. The conditioned transitive MO plays an important role in the teaching of children with autism by increasing the number and variety of items that act as reinforcers. This gets to the issue of, well, he only has a few things he really sort of likes. How can I expand his man repertoire? The use of transitive MOs can get at that point and begin to develop a much larger pool of mans that can be taught. Several researchers have demonstrated the benefit of contriving transitive MOs to teach mans to persons with developmental disabilities and autism, and I cite the studies that have done that. Let's look at some examples of applications of this research with children with autism. I first want you to look at the diagram, however, that illustrates the controlling relations that you will see in the following video. And this may get to the point that Jack Michael was making somewhat this morning about a kind of a molecular analysis of what's going on may be necessary in the repertoire of the teacher in order to be able to contrive these sort of opportunities for mans to occur. For this particular child, Andrew, who you'll see in the next video, seeing a completed picture of a train is effective as reinforcement. He loves to see a completed picture of a train drawn. That establishes the teacher's movements related to drawing of each part of the train as a reinforcer, and in fact, the missing items there will act as reinforcement. As a result, it evokes all responses in the past which have received this form of reinforcement. What you'll see here is Andrew mans for Kathy to draw each part of the train. This little diagram here is what you'll now, pretty much describes what you'll see in this video now. Yeah. The initial teaching of social skills with children with autism often requires the manipulation of relevant motivative operations. Note in the next video clip with Andrew, he's learned to ask for Jimmy and Allison to join him in his favorite activity, swinging in a manner he calls bumpy. They have all kinds of ways of swinging. Swinging in a certain way is effective as a reinforcer for Andrew, which establishes any movement of Jimmy and Allison towards the swing when they're not near the swing as an effective form of reinforcement. In other words, any movement that they make towards the swing when they're far from it, when in fact swinging in a certain way is effective as reinforcement, will in fact evoke all responses in the past, which have basically, if you want to put it in a fairly technical way, decreased the distance between Andrew and the swing and Jimmy and Allison, and therefore Andrew mans by saying, "Come on, Jimmy, Allison, bumpy." Social skills training may require this form of contriving of motivation, but capturing and contriving those sorts of motivative operations is absolutely critical, and maybe social skills training ought to start with consideration of the relevant motivative operations in order to make that teaching more meaningful and more functional. Let's look now at a more advanced form of manding, and that's manding for information. Skinner states, a question is a mand which specifies verbal action. In other words, there are stimulus conditions on which a verbal response information has been established as a reinforcer and therefore evokes a question, a mand, the answer, the verbal action, to which in the past has produced some form of reinforcement, usually more effective action by the asker. For example, if my hat becomes valuable as a piece of warm clothing, S1, and I discover that it is not to be found in its usual place, S2, then information about its location will be established as a reinforcer and therefore may evoke the response, "Where is my hat?" since that response has previously produced information that directed me to my hat when it had reinforcing value. Sundberg in 2002 in the analysis of verbal behavior demonstrated that mans for information regarding location and specific information about a person could be taught to children with autism by manipulating transitive establishing operations, or MO. Let's now look at a video example of manding for information. I want you to notice how the instructor must prompt some forms of the appropriate man for information question when the MO is strong, but when the learner does not have the form of the response in his or her repertoire. You'll notice how precise you must be to contrive the motivation, be able to see that at this particular moment before some other response like a tantrum occurs, Because mainly manding for information to a large degree is removing some aversive condition in many cases, and you might very well see some tantric sort of behavior. Catch it at just the right moment, prompt the correct response, and deliver the information as a reinforcer. As you watch the video, I want you to follow along with the diagram I've put together that's just below. Most of you have a handout. If you don't, I'll just describe it very quickly here. In this video, you will hear Diego and see him manned for the information with responses why, where, how, which, and who. Notice the complex arrangement of motivational conditions that are necessary to evoke the responses and the precise timing of the prompts to teach those responses. Let's look at this diagram. I won't go through all of the examples, but we've pretty much set up this manning for information in a chain sort of way. Let's take a look at it. First of all, manding why. Diego is watching the video, which is acting as effective as a form of reinforcement. Kim says to Diego, press stop, which now establishes an explanation of her request as a reinforcer, and you'll hear Diego, it will evoke Diego to say, why? The reinforcer for that response is Kim saying, because we're going to play with some toys. Now, because we're going to play with some toys, now also establishes additional information, should it be reinforcing in any way, additional information about the location of the toys as a reinforcer. It therefore evokes Diego to say where. The reinforcer Kim provides is over at the table. Well, once they're over at the table, and you'll see Diego go over there, he says, well, let's put together Mr. Potato Head. It seems like not an age-appropriate thing. This is about a 9-year-old boy, but this is an exploding Mr. Potato Head. Some of you may see that. You push a button and everything explodes, so it's really quite reinforcing. At this particular point, he's trying to put Mr. Potato Head together, and it's reinforcing to do so for some of the reasons I just described, is acting as effective form of reinforcement. But Diego cannot put the backpack on the toy. At this particular point, that establishes instructions about how to do it as a reinforcer and evokes Diego to say with an echoic, Kim must provide an echoic prompt. Because he first says, help me, which is not a bad thing to say, but you'll get more specific information and your action may be more effective if you ask how. So how do I do it? And Kim tells him. She kind of shows him. It doesn't tell him quite as much, but you kind of get it's kind of hard to tell him exactly. The verbal action there would be a little confusing. Criticism of behavioral account of language have focused on the apparent low rate of direct reinforcement for vocalizations produced by young children. Schlinger in '95, excellent book on behavioral analysis of child development, suggests that these criticisms result from a general misunderstanding of the concept of reinforcement. Environmental consequences, which are much more subtle than food, tokens, or praise, may play an important role in strengthening vocal behavior. Glances, smiles, touches, and even continued question asking may well serve that function. In his discussion of verbal behavior, Skinner suggested that some reinforcement might be automatic in the sense that there are not any immediate external consequences. The seminal sort of writing on the topic, specific to Skinner's work, was by Michael and Vaughan in '82, that talk about the fact that it's a natural result of behavior, automatic reinforcement is, when it operates upon the behavior's body or the surrounding world. What makes this form of automatic reinforcement is that it does not depend upon the mediation of another person. Specifically related to the development of vocal responding, Skinner said, if someone repeatedly reinforces someone with the verbal stimulus right, we must not exclude the possibility of the speaker's reinforcing himself in the same way. The young child alone in the nursery may be automatically reinforcing his own exploratory vocal behavior when he produces sounds he's heard in the speech of others. This two-step process may play a significant role in the development of language of many young children. Two-step process is this, and then I'll skip ahead a little bit. The speech sounds and words heard by young children are frequently conditioned as reinforcers by correlation with parent positive reinforcers, caresses, food, so on. Subsequent production of these sounds by the child is strengthened by the product of his or her verbal behavior in the form of auditory stimuli. The closer the sound production matches the sounds that have been conditioned as reinforcers, the greater the reinforcement. Schlinger states that automatic reinforcement is a plausible process and observable and testable, and Dave Palmer has written extensively on this, especially as it relates to more complex verbal behavior. The auditory feedback from one's speech can play a special role for a speaker who's become a competent listener. And I give you a kind of a diagram here about how this sort of this develops. There have been several studies, and I'll kind of paraphrase here and go to some video. There have been several studies that have verified. There's a nice line of research on this. It may not be all we need, certainly, but a nice line of research, some done by Mark Sundberg, by Yoon, and then by Jack Michael and Kyle Miguel on this sort of process by which they were able to produce vocalizations in children that were never directly reinforced, but were reinforced through this two-step stimulus-stimulus pairing process. In 2002, Miguel et al. Suggest that further demonstration of the practical benefits combined with direct reinforcement will be necessary for wide-scale adoption. Well, what we've done in our clinical practice is to do just that. We've taken children who have had very little babbling responses and hardly any phonemes, consonant vowel combinations. We've then presented those as neutral stimuli, paired them with the delivery of reinforcement, and at the same time, once the response begins to occur through an automatic reinforcement sort of process, then we purposefully begin to bring it under man control, if you will, or basically motivational control, by then reinforcing directly. I think the notion that automatic reinforcement works, so to speak, and this two-step process works, we can now take advantage of it. And now what we do is we can shape up more and more sounds through this process. Let's take a look real quickly at a 20-month-old boy with autism, who we began this process with. It'll probably take me about 5 minutes to do it, and I'll be done with it. Let's take a look at what this looks like. This is a boy by the name of James, okay? He's sitting there in a beanbag, looks like a king, doesn't he? He's 19 months old. We're saying ka. His babbling is very low. He has 5 consonant vowels that we hear. He mans, let me back up. He produces babbling responses at a very, very low rate. There's only 5 consonant vowel combinations he makes, 1 vowel sound, and they all occur at a very low rate. In fact, the highest number of actual responses we heard was 43 in a 3-hour period. This guy had very little verbal behavior, certainly not under any stimulus control, and was not producing a lot of sounds. Let's watch. You'll see here when we present ka, you're not going to hear anything here. You'll hear some sounds, but it won't be ka. Now that's a fairly atypical reinforcer there. I mean, he's flashing cards, that's the reinforcer. The flashing of the cards, actually, we had already shown that that would act as a reinforcer. And now giving the cards the opportunity to play with it as a reinforcer. Watch what happens next. Dumping those toys on him was a reinforcer. And now placing him in this box here is a reinforcer for James. All right, let me fast forward to the next clip. We were getting some sounds, but it wasn't ka. Listen here now. This is hundreds of trials later. Listen to ka coming under a echoic control and then ultimately turns into a mand, as you'll see. That's a reinforcer. There it is. Hundreds of trials later. But only several days. He loved putting things in here. Listen. Other sounds. There it is. Now she's also delivering it. Many of the studies actually did not include this process so as to not adventitiously reinforce it and turn it into a man. We purposely did that. The literature is pretty well established that we're going to now reinforce it directly as well. There he goes. You can hear it. Watch what he does here. That's the reinforcer. Getting the item. Puts it in. Fast forward right here a little bit. Sticking your tongue out at him was a reinforcer as well. Now watch what he does here. There it occurred without the echoic stimulus. It's a man now. Watch what he does right here. And there's the ka sound as he points to it. It's actually been turned into a man. Now that we have that sound occurring, what we do then is we now begin to run echoic trials on all the sounds that we've produced. Watch how we now have Declan's responses under several different responses under echoic control, and then I'll show you the development over 8 months of his vocal verbal behavior.
Da. Do this. Walk. Give me 5. Ta. Do this. Ba. You are the best.
None of those sounds were in his repertoire previously. We systematically produce the sounds, bring them under echoic control. We now have a pool of responses that we can now use during man training and during the teaching of other verbal operants to now begin to select those sounds now that we have a fairly high rate of them. You'll hear it right here. Here he is now in man training, and watch what he does here now. You'll start to hear some good vocalizations. I will be done in a second, I promise you.
Oh, can I put your puzzle pieces here?
Listen to him here now.
Thank you. Sure.
It's a man.
Woo! Yeah, there you go. Here we go. Up. Ready, set. Ready, set, go!
Yeah, there's a multiply controlled man under also a control of a verbal stimulus. It's kind of an intraverbal sort of man response. Watch this next one.
1, 2, 3.
Now we get him there. Listen to him here now a few months later. This is over an 8-month period.
Roll, sure.
That's what he likes to do.
Roll, whoa! Whoa, here we go, woo! I got the belly, Roll, sure, here we go. How about bounce? Bounce, boom, boom. Roll, yeah, that
Watch his
way.
face here.
Roll.
There he's doing some man. We did some sign training with him as well. Now let's listen to him several months later. Listen to his manned repertoire now. Remember, this is a guy that had 5 different sounds at 19 months. The rate was very, very low. We heard 46 in a 3-hour period, consistent over 6 days in our initial baseline. And take a look now. Listen to his man several months later now.
Monkey.
Monkey, right? What does a monkey say? Way to go! And what's this one?
Bird.
It's a bird. Here's the bird. That's okay. Put the bird in the puzzle.
Tweet.
Tweet, tweet. You're right.
Lion.
Lion. Good job.
Wait.
There he goes. Where does he go?
Here.
That's right. Put him there. This is a hard one, Declan. This is a leopard.
Leopard.
Good.
Leopard.
Notice how
That's right,
strong
that's a
that
leopard.
response is now about 6 months later. Let me show you him a couple more months later in a tacting repertoire now. This is a guy that just didn't produce any sound. Listen to him here. This is what he sounded like just a few weeks ago after 8 months of man tact and basically automatic reinforcement procedures.
Bed. Toilet. Tiger. Okay.
That's a square.
Cupcake. Ball.
Let me tell you a quick anecdote. I have data on this, so I'll flow it up in just a second for you to take a look. His mother, in one of our final meetings, moving on to some other settings that would be appropriate for him, she said to us, "Thank you for teaching my child to talk." And I just said, "Well, we're glad we could do it." And she said, "You know, I'm absolutely convinced it was that automatic reinforcement procedure." Now, this is completely anecdotal. I don't have a I have a control study on the development of the sounds. I don't have a control study on every independent variable, so to speak, and manipulate it. But she said, "I was absolutely convinced that you made my child enjoy the sound of his own voice. He enjoyed the sound of his own voice, and as a result, it was just reinforcing to hear it. And then when you brought in the manding, now he enjoyed that, and now his voice was reinforcing just in and of itself other play." She would hear him walking around saying all these sounds that she had never heard before after the work we had done. And I think it's also pretty nice to just hear a mom talk about automatic reinforcement in a very technical sort of way. I'll just quickly just show you, this is some of Declan's data. I don't have a chance to go into it. You can see his baseline rate of da and gu are very, very low. Pairing and direct reinforcement, you see the change quite clearly. We went to a reversal, you can see, and basically we produced a change in the repertoire. Why wasn't it occurring there? Because remember, by now it's a mand during the pairing and direct. We stopped reinforcing it, a few hits, but then it drops off pretty quickly. But we didn't stop reinforcing the behavior. We brought it over to an echoic, so we maintained it. We weren't maintaining the sounds as a mand at this particular point. We were maintaining it as an echoic. Last point I just want to make, and then we'll call it a day, and I'm sorry for running over just a little bit, but I hope that point. In a personal communication from Mark Sundberg, he wrote to me recently, and it's some other work that Mark has done. While clearly a substantial amount of research now exists, there is much more research that needs to occur before it could be said that the necessary and sufficient evidence for the empirical support of Skinner's conceptual analysis of verbal behavior is available. Given the empirical evidence, however, and these are my words, that we currently have in support of Skinner's 1957 analysis, it appears that practitioners who provide services to children with autism have an obligation to develop a repertoire related to teaching verbal behavior. Thank you very much for the opportunity to be with you.